I'm Dinane Kaye, and I lead growth for Asthmapolis, so I'm responsible for commercializing our products and services. And we're delighted to be here this morning to talk to you about what we're doing in asthma and soon COPD. As many of you know, asthma prevalence is growing, affects about 25 million people today, and 60% of people with asthma are walking around with uncontrolled asthma. And many of those people, about 80%, think they're doing okay because they're not educated to understand that there's more we could do to help them better manage their asthma. This results in a lot of cost to the system, $50 billion in annual costs, largely driven by unnecessary, potentially unnecessary hospitalizations, as well as ED visits that could be avoided. This is Eric, and Eric considers himself a very typical person with asthma. He grew up with asthma, was always around holding inhalers. He's one of our beta group. We started with a group of probably have about 500 consumers and patients who are in a beta group that are sort of our initial data set to understand how we best engage patients, etc. Eric has sensors that look like this that snap onto his meter dose inhalers. We attach to rescue medications as well as a percentage of controller medications and are working on sensors for other form factors. The sensor itself collects the date and time of use of medication, and that data is stored in the sensor. The sensor is paired with either a smartphone or a Qualcomm 2net hub. So the data are stored in the sensor, and whenever the patient is in contact carrying around their smartphone or in the home with their Qualcomm 2net hub, the data are passed from the sensor to our servers via Bluetooth. The important thing about the use of the smartphone is we leverage the GPS within the smartphone to pick up location of medication use, which is an important, obviously important signal for asthma. And then we provide that information and insight back to patients in terms of where they're using their medication, how frequently they're using their medication, how well their controlled asthma is, and we use national guidelines to provide them information and insight and education about what they could be doing differently to better manage their asthma. This is an example of our webpage that patients have. They have their own personal account. This gives them feedback about how many rescue events they've had, how compliant they are with their controller medications, what their trends look like, what they could do differently, key alerts, and importantly, a map. They can put in key locations, work locations, school locations, where they travel in their day to understand whether there are key things happening environmentally that seem to be triggering their symptoms. And we do have a relationship with the Weather Channel, so we essentially use the GPS and location information to get weather and air quality information to understand whether there are things in the environment that are triggering their asthma. We also, if a patient uses their rescue inhaler, provide push notifications to the patient so they can easily enter a symptom, coughing, chest pain, etc., so that we can gather and collect more information about their asthma, again, to improve the advice we provide back to those patients. This is just a couple of examples of the mobile app. Again, same information we provide on mobile app as the web page. And we also send a weekly report to patients via email, or in some of our cases, our Medicaid patients, via the mail, about their trends and how their week was. And importantly, we just juxtapose their use of rescue medications with their adherence to controller medications to begin to give patients a better aha about the relationship between adherence to controller medications and the implication on their need for rescue medication and the implications of the events they may be experiencing. We are available entirely in English and Spanish, so all of our support services and our applications are available in Spanish, since many of the populations we are supporting have Spanish as their primary language. And the whole system together is designed to essentially engage patients and meet them where they are. We don't rely only on text messaging. We don't only rely on a mobile app. We have asthma nurse educators, Kathy, who will make calls to patients that seem to respond best to a phone call into the home. And our goal is to understand, obviously, the trajectory and use of consumer technology, and to understand we're in the service business, and we need to provide that service to patients and meet them where they are. We also enable clinicians, obviously, to see how well their patients are doing. So this would be an example of a view of a clinician dashboard, or in the case of payers we're selling to, a dashboard that a case management team might be looking at. It summarizes how well their patient's doing. The patients can drill into each patient's record to understand specific things that the patient may be doing or needs to be doing. And we can also set up to provide alerts to care teams. So if they're not logging in, which we know is a painful process for busy clinical teams, we can provide an alert based on the alerts that they define about when they want to know that something's changed for Mrs. Jones, or they want to know for all their patients when patients move to a poorly uncontrolled state. We are working on EMR integration. We're headquartered in Madison, Wisconsin, where there's a large organization there that we're working on Epic integration with, which will be our first integration, and then it's a long path to travel, but we are on that path. This just gives you an example of where we're deployed today. You'll see Dignity Health, former Catholic Healthcare West. We have a clinical study going on there. That study started prior to our FDA clearance last summer. 450 patients, half in a control group and half in an intervention group. That's been running up to a year, and our longest patients on that trial have been on for a year. Also, you'll see Louisville, Kentucky, where we have a program going on with the City of Louisville. It's a collaboration among the City of Louisville, Humana's on the advisory board, and a series of clinicians. And the reason we have Walgreens up there, we have various ways that we engage patients, and in that case, Walgreens is where and how we're distributing to the patients who are part of that program, and it's also a clinical study. Our first commercial sale we're excited about is with Amerigroup, a WellPoint plan in Florida, where we have 250 patients, all Medicaid managed care enrolling right now. And also Wyckoff Heights Medical System in Brooklyn, New York, also treating an underserved population with high prevalence of asthma. And we have two that we'll be announcing shortly, one in Northern California with an integrated health system, and one in Southern California with a large health system. You know, we think importantly our goal is to target not only people that like technology and are typically adherent but need some advice and guidance, but also those who are typically not adherent, where a lot of the costs are driven. So we are focused on enrolling those in patients and understanding in a highly analytic way about where patients engage in our systems and how they respond and what creates change. A lot of our focus and emphasis today around engagement and engaging the patient. This is some of our initial evidence. This is actually the results of a CDC-funded pilot. It was actually several years ago with a much earlier version of the sensor, and in that case we pushed only an email weekly to patients. In a short period of time, you can see that there was a 1-month control period, in which case we had sensors on rescue medications, but patients were being provided with no feedback. And you can see pretty quickly once they get some feedback, they improve their levels of control. This was published actually about 3 weeks ago in PLOS One, so it sat a little while in CDC review, but that's now out. This is very early data from our Dignity program. Again, it is a randomized control study. You'll see in red patients in the control group and blue patients in the intervention group. You'll see the gap where they start off in the program, not a statistically significant gap. And you'll note that they both improve in terms of the number of rescue and inhaler events over a week's time. And we attribute that largely to the Hawthorne effect, because the patients in the control group do have a sensor attached to their medication, but neither they or their clinicians are getting any information and feedback. And also patients tend to be referred to this program after discharge from the hospital. But you can see post 4 months, 16 weeks, you see the gap begins to increase. Similarly, this is early results from our Louisville study. In this case, it's similar to the CDC study, where there's a control period of a month where people have the sensors but are receiving no feedback. In this case, no clinicians are involved. This is the City of Louisville program distributed to Walgreens. And you can see as the intervention period, again, about 4 months into it, improvements in level of asthma control. One of the things we really think hard about is that patients, particularly if they have a chronic disease, don't need additional burdens. So we try to sort of think, how can we passively collect data from patients, not create much change in their lives? And we do that once the sensor is on. Every time they use their medication, we receive data. And again, we support them with a service that's wrapped around it. Goal is obviously to reduce the cost of this disease and improve control and quality of life. We've been very fortunate to receive some very favorable press. Nothing that we've done, but people have found us, and we're very pleased and excited about that. Our next foray in development now is COPD. The product design is a little bit different, but since people use the same and similar medications, we adapt well to COPD. And this is Eric, who feels like he's a little cooler because he has this on his sensor, he says. He's been able to cut his rescue medication and understands now what triggers him. For him, it was he would go to a friend's home and always need to use his rescue inhaler.